Hi there, everyone. I'm Rendy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. Today is Monday, March 7th, here to give you an update on the impact of the COVID-19 pandemic on Mobile County. You might have heard that the WHO has announced that we worldwide have hit 6 million deaths from COVID-19, but hopefully the worst is behind us. In our weekly updated report and our daily report, you will see that we still have a very low number of cases. The number of hospitalizations is down less than 50 the last couple of days. We have a very small number of our provider visits across the county are for COVID-like or influenza-like illness. The percent positive test positivity, we have been looking at that for quite a long while now. It is down around 5% for Mobile County, which is really good. And the number of deaths are going down as well. So this will, all things are going in the right direction. We've been really happy to say that. We've got about another 5 days until we kind of are out of the woods with what we might have seen associated with Mardi Gras. Transmission, in large gatherings and indoor social gatherings, that sort of thing. But I don't expect that we're going to see a big spike this week. People seeking treatment, seeking testing, seeking vaccination has all gone down as well. So this will likely be our last Facebook Live specifically for COVID-19 pandemic in a while, as long as those numbers continue to stay low and there are no new really big pieces of information to share with you. So that's really good news. I want to comment on a big change that CDC made last week with regard to we used to call it the community risk level, and these were the 4 levels of, community risk. So sort of looking at how bad is it in the community, looking at primarily the number of cases, the 7-day number of cases, and the 7-day percent positivity. And there were 4 levels associated with that. CDC changed course. I believe it came out last week. And what I believe the image is here for the state of Alabama. This is the new, they're now calling it community levels by county. And you can see there that Mobile County is in the high category, but don't worry, this is a little bit based on a reporting aberration, which I'll try to explain a little bit. But basically, CDC is moving away from using percent positive and instead using these indicators. So the number of cases per 100,000 people in the last 7 days, and then 2 other things which really, instead of encouraging, different levels of prevention based on percent positivity and community transmission, they're moving towards these levels that are really measuring the impact on the healthcare community. So again, instead of using the old method to encourage prevention measures like masking and distancing, what they're doing now is moving to minimize severe disease and keep our hospitals from being overwhelmed. So the 2 new indicators are the COVID-19 admissions per 100,000 population. This is a 7-day total, and then the percent of staffed inpatient beds occupied by COVID-19 patients, again, that's a 7-day average. So if you look at this map, it's showing that we are in the high level. There are only 3 levels now, low, medium, and high. And right now, Mobile is in the high level because in the past 7 days, we had 244 cases of COVID per 100,000 people. Hospital admissions per 100,000 were 11.3, and the percent hospital beds occupied with COVID patients was 4.5%. Now, if you remember last week, we talked a little, if you look at our daily report on March 1st, we had an artificial spike in the number of cases that were reported. So this was a reporting facility that processed a backlog of COVID tests. Sometimes that happens when things get slow and people can get back to cleaning data and checking that files have properly processed. And so that reporting aberration that occurred on March 1st is likely what has kicked us back into the high level. So I know this is a little bit confusing. If you look at both the CDC community levels and the ADPH, the state health department is still using the old method. So they're working on getting their dashboards updated with the new method, but they have been using the old method, and using the old method of number of cases and percent positive, we are in the moderate category. So again, don't be alarmed that we kicked back up. About a week from now, maybe sooner, you will see that we will go back down into the medium community level. So again, all things moving in the right direction. So thumbs up to everybody. Calculate your risk. If you are subject to severe illness, should you get COVID, whether you're vaccinated or not, maybe be a little bit more cautious. If you're young, healthy, vaccinated, you can probably, like we said in November, you go back to enjoying most of your daily activities without a mask. At the health department, we are still continuing to mask indoors in the high traffic areas where we encounter people from the public that we don't know if they're vaccinated or not. But as you probably saw on the press conference on Thursday, when we're outdoors, even some of us are beginning to get back to not wearing a mask when we're outdoors, particularly if we're around people who are vaccinated. So if you enjoyed Mardi Gras and went to some indoor gatherings and attended some parades and ate and drank and celebrated with your friends and family that may not all be vaccinated, you should get tested. Think about getting tested. And so remember, we reopened testing starting on February the 18th, I think, through March 11th. March 11th is a day that some of our test kits expire, and we're going to use them up to give you an opportunity to get tested after Mardi Gras. So please, March 11th is also 10 days past Fat Tuesday, so that should be the end of the incubation cycle for COVID-19 transmission. If you were out and about during Mardi Gras, please come to our Festival Center location. You go online to appointments.mchd.org to schedule an appointment. We've got plenty of open slots available, so please go and get tested. Just remember, if you're sick, stay home for at least 5 days. And if you have been exposed or you think you might have been exposed with someone with COVID, wear a mask, go in and get tested. So I am not seeing anything in the surveillance data that makes me concerned that we had a lot of transmission during Mardi Gras. It is still looking pretty good, though we know that our count is artificially low because lots of people, may have used their at-home tests, and those aren't reported to us. And then also we know a lot of people will have asymptomatic or mildly symptomatic infections, and those may not be recognized as COVID-19 infections and reported to us. I think mostly everyone is just like, I feel good, I might have the sniffles or a mild cough, but I think we're all happy to see that things are low and hopefully going to stay low for a while. The things that we're sequencing each week are still Omicron, so we've not detected the new BA.2 variant in Mobile. So again, fingers crossed, but all things are looking really good. So let's see. I think the only other comment or question, I guess, someone from the media sent an email that today the Florida Surgeon General announced that healthy kids don't need to get a COVID vaccine, which I do not agree with. The vaccines are safe and we need children getting their vaccines. So unless new evidence becomes available, and things change all the time, but unless new evidence comes to light that would give cause for the Advisory Committee on Immunization Practices to change their mind about COVID-19 recommendations for children, I will continue to support the ACIP recommendations for all childhood vaccines, including COVID-19. So unless there's something, Mark said not that we're doing okay. So again, as always, in the past 2 years, we're coming up on the anniversary. A first COVID case was reported in Alabama on March 13th, Friday, March 13th. in 2020, and then the first case in Mobile on March 19th. So things are looking good out there. We'd like for them to continue looking good. So be wise, be smart, layer prevention measures to reduce your risk of COVID-19. Continue doing so. It's going to save you from lots of other exposures of respiratory viruses too. So it's always a good thing to do when you're in a higher risk environment. Mask, distance yourself. Certainly stay at home if you're sick, and get vaccinated as recommended by CDC and ACIP. So take care, everyone. Be safe, and hopefully we won't need to talk to you anytime soon.